I'm Dr. David Hill, and today we're going to be talking about eczema in a newborn. What is eczema? Well, eczema is a skin condition, and it's a combination of dry skin and an allergy. So when we try to fix eczema, we try and do things that help both the dryness of the skin and the allergic component to the eczema. Now, eczema is very common in infants, more common in infants who have a family history of allergies, asthma, or eczema in other family members, but it can occur in infants without risk factors as well. What you'll see is a dryness of the skin, maybe some fine red bumps. They may itch or look uncomfortable. They may have some dry patches. If you're uncertain about a rash that your baby has, absolutely you should bring that baby to a provider to get a look. Sometimes it's hard for us to tell as well, but we do see eczema all day long and have a pretty good idea what it looks like in most cases. Now, if you suspect your baby has eczema, what are you going to do? Well, you absolutely can use a moisturizer. We prefer moisturizers that are really thick, things like Eucerin, Aquaphor, or Cetaphil that come out of a pot instead of a pump. If you can pump it, it's probably too thin. We also like moisturizers that don't have scent or color. So Johnson's & Johnson's, the pink stuff, lovely idea, smells great, but may contribute to allergies. So we like things that are more hypoallergenic. Now, when the moisturizer isn't working, you can go on to a low-dose steroid like over-the-counter hydrocortisone cream. You can use that a couple of times a day until things are under control, and then back down to the moisturizer. You want to be sure not to bathe your baby too often. Most infants only need a bath every 2 or 3 days, and you really don't need to use a lot of soap in most cases. The soaps will dry out the skin by removing oils and make the eczema worse. Sometimes you might consider a diet change if you're breastfeeding, away from milk, soy, wheat, or peanuts. If your baby is formula fed, sometimes changing to a hypoallergenic formula can help as well. For babies 6 months or older, using an antihistamine like Zyrtec, cetirizine, or loratadine at that age group, that may also help. Talking about what to do for eczema in infants, I'm Dr. David Hill.